I was, for many years a writer and a health journalist, and was very attracted to the idea of moving more into academic health communication and advocacy, etc. And this is, it's been a fairly organic journey, because I started to feel the need to work more directly where communities can be influenced. And that's when I made a switch about 15 years ago and moved more into health communication, advocacy, or even public engagement to be able to take more and more evidence towards the public. Well, interestingly, it's such a long list that sometimes I wonder that why is it that we are still even discussing and debating this whole idea of how there has to be, or there have to be, social determinants of health. Actually, health itself is very much rooted in our social aspect and in the way we conduct our lives. It's so intimately connected with the choices we make. And they're very different for different people and for different communities. So in that, given that larger perspective, if I was still asked to, draw up a list in a sense, I would say almost everything, right from my ability to generate income, my economic privilege or the lack of it, gender, which is a huge issue. What kind of rights do I exercise, rights of freedom, of choice, etc. The level of education, which can affect not just me but my entire family and generations. Therefore, I would say that almost everything encompasses social determinants. More recently, we've also started looking at issues like water and sanitation, and just our right to a clean environment. So all that, of course, is directly something that directly impacts health. So I would say all of this, which together creates what we call human development, and basically the fabric on which human society gets developed. According to me, there are really no limitations to an SDH approach. They can only strengthen our ability to develop better public health outcomes for populations and for nations and for the world, because if you were to address, let's say, even one social determinant in a community, let's look at employment, the ability to have a guaranteed employment and income, that itself can have a remarkable impact on the health of that family, on their ability to access health service, pay for it, or even be able to deal with an illness or a phase of illness and come out of it without getting pushed below the poverty line. So I would say only strengths, because then we will automatically start to see improvements in health without having to keep investing in treating illness. If I work in the health sector, then for me to consciously be aware of what is happening, for instance, in the social justice programs, or in the women and child development programs, or for me to be very engaged with the education sector as to how are the programs happening in my community, or if I'm working in the sector, then how do I work with those people? How do we connect, and how do we pool in resources? And which brings me to this point that I think another major strength would be that we would all end up saving a lot of resources which are being spent right now in very fractionated kind of ways. So different programs are spending on the same issue, whereas if there's a concerted and converged approach which many of us who worked in the HIV/AIDS response know that how much time it took us to even get India to start thinking about convergence and mainstreaming. But then we've seen the results of that, and therefore I think whether you call it taking a social determinants approach or you call it convergence, whatever name you call it by, end of the day it can only be a strength. Yes, as a person working in the development sector, I'm aware that a lot has been done in terms of trying to articulate policies, for instance, policies that connect different social determinants to health, or programs that address social issues with health. Maybe there have also been articulations and directions of what kind of committees need to be in place, what is the mechanism that the government wants to adopt in taking that kind of an approach forward. But if you actually start looking at what is happening on the ground for ordinary people, that's where my concerns lie, because that's where I feel that maybe it's an issue of implementation, which is something that all of us working in public health struggle with, that what is the level of efficient, impactful implementation of programs which have already been well articulated, or for example what is the kind of cost-effective utilization of financial resources which are being made available for running a program. But end of the day, I think where I would like to really see far more action, and not just see but also work on far more action, is that vulnerable communities will have to start seeing some change in the way they are getting trapped in various social challenges, and how those challenges are taking them towards ill health, and how then ill health becomes a separate trap out of which they are not able to come out. So it would be great to see far more on-ground action, maybe not even looking only towards government but also looking at civil action. And to me, and maybe that's because I'm a communicator and I look at behavior change, I think communities and all of us as communities need to think about our own behavior and attitude to these very crushing social determinants. So, what am I doing, let's say, as a woman in a family? And when I say I just mean generally, what does a woman do? When she's seeing some of these social determinants impacting her health and that of her family, is she able to speak up? Is she able to negotiate a change? And I think end of the day, that's how real change will come. Most certainly, I think they are really our future, and they are the ones who will be able to bring this transformation or this gear shift, I would say, in the way health research or public health research can actually be seen as something very actionable on the ground. Because my concern in recent years has been that many of us working, whether in policy research or in pure health research or in various areas of public health, of the public health response, we are not actually focusing on the changes that need to be brought about at the grassroots. So my appeal to a lot of younger people would be that as they fashion their research agendas, they should consciously think about how it's going to translate into action. And they may not necessarily be the best people to do that, but to remain networked and to remain very conscious of all the other stakeholders who are available there, to be able to take that research forward, create it into, fashion it into very usable evidence, which can then further create a huge pool of information, knowledge and awareness, which all of us know is ultimately it is knowledge that will help me act, and to be able to take their research findings to different kinds of stakeholders, whoever may matter, in ways that those people would understand. So to be always conscious that you will have to learn another language. It's like we say that, it's not enough to know Hindi and English. It's always good to know one more language when we work in India, at least one more. So similarly, to learn another language of how do you package your information and evidence of research so that people can actually use it.